problems.
Wonderful.
Waking
Thank
up,
you.
doing okay?
Wonderful, yes.
It was just like we expected. There was one little wrinkle, but nothing major. She has had a little diverticulum around the left ureter orifice. Here, I'll show you what it is. So this is the right side. You see how it kind of looks like almost like a little slit-like opening. That won't reflux. I'm really confident in that. So whereas the left side, here's the hole right here, but you see this weakness right here behind it? That's called a diverticulum. It wasn't really big, but that's why she was refluxing on that side. So with the reimplantation, we reinforced that so there's not that weakness behind it. And so, I would be really surprised if she refluxed after that. I do think that Demi holds her urine a fair amount, and I'm not sure she relaxes all the way when she pees, because her bladder was pretty thick. It's kind of like when you do bicep curls, your biceps get big. Same thing with your bladder. If you're not relaxed all the way when you go to the bathroom, you'll have to push harder, and it makes that muscle stronger and thicker, which isn't necessarily a good thing for the bladder. So that's just another thing to keep in mind moving forward. Making sure she goes to the bathroom regularly, making sure she relaxes when she goes, trying to make her take her time. Those are all things that can help keep her from getting the urinary tract infections. But the reflux should be gone now. With her age group, it's kind of hard to teach them how to relax. You can do physical therapy, and if there's ever issues down the road with recurrent bladder infections, we can still pursue that. But we minimize the risk of her getting the fever and vomiting with the infections. Okay, does that make sense to you? Now we just need to get her over the surgery. So she's got the little incision right above her pubic bone that's covered by glue. Stitches are on the inside. She's trim enough that you may feel some of the stitches on the inside as they're dissolving. And she'll have a little bit of discomfort there. And the nice part about doing the outside the bladder reimplant is you don't have the bladder irritation as much, especially once you get the Foley catheter out. We'll probably take the Foley catheter out in the morning. If it's really bothering her, we could take it out later today, but I don't expect her to have problems peeing. We just generally don't take it out in the afternoon or evening so that they don't have problems peeing in the middle of the night. We'll let her eat some food, whatever she feels like. She should be pretty well numb for a few more hours because of that block. We'll have plenty of pain medicines for her. IV Toradol, which is kind of like strong Motrin, and the Tylenol, and then oxycodone and morphine, and then nausea medicine too if she needs it. She's going to be sore. She seems like she's pretty tough, but you'll probably have to encourage her to get out of bed tomorrow and move around and walk and things like that. And tomorrow, if she's eating well enough, or especially drinking and peeing well, and she's just taking the oxycodone, then sometime tomorrow we can probably let her go home. We'll be checking her heart rate, blood pressure, urine output, all that stuff until between now and then. And then, of course, if there's anything that doesn't fit, we may get labs or things like that. Right now, I'm not planning on doing anything like that. And then as far as the dressing goes, that little glue, you just let it come off like a scab. Don't pick at it or put anything on it. It'll just come off in a week or two. Okay. And we'll sponge bathe her until, Friday. That's the rundown. Feel good about it?
So if everything goes according to plan, we'll be out of here tomorrow afternoon.
And then the next follow-up one will be, 1 month, 2 months up in Lowell. We'll do an ultrasound, make sure the kidney's draining well. And then after that, we just follow her, maybe every 6 months for a year or so, make sure she's not having problems. And then, at that point, maybe I'll let her go. Okay. But I do think that this is something we just need to stay on as she gets to be 5, 6, or 6, 7, 8, 9, 10, up until a lot of times by the time they're teenagers, they kind of learn how to relax more and kind of take more time. But, that's not always the case. Sometimes it carries on into teenage years, just not relaxing when they pee. But really, urinary tract infections, accidents, things like that, that's the sign that she's still having some trouble.
So she does still have frequent or
has frequent, like, she'll pee in her panties just a little bit, not enough to like change her whole clothes, but just her undies. Do you think that'll be something that will be less of, or could
You know,
still be a
sometimes
problem?
right after this surgery, they can have a period where it's actually a little worse because they're anxious about it hurting when they pee and things. So sometimes there's a little bit of adjustment to that, but it shouldn't impact that negatively in the long run. And I have seen a lot of kids who it goes away entirely after they do this because, you know, they are able to empty better. They don't have urine refluxing back up and then coming right back down. Does she leak more on the way to the toilet or after?
Well, I'm not sure because she's so independent as far as taking care of. She'll get new panties on her
She seems
own.
like she rushes to the toilet.
If she says she's got to go, it needs to be quickly.
Yeah.
Like if we're on the road, we got to
So
find
it's
it quick.
probably that, and I mean, if she waits the last minute, is that fair?
Possibly,
Yeah.
yeah. I know there's times when she doesn't want her siblings to get toys or something where she might put it off.
Yeah, so I would say, you know, keeping her on every five time a day to 6 times a day avoidance schedule, regardless of whether she wants to go or feels like she needs to go, would be, you know, mandatory for. And you know, we can get notes for school and things like that, but that'll just help keep her from having that urgency, probably keep her from having the accidents, and then keep her from having the UTIs.
Yeah.
When they hold it for long periods of time, they're more likely to get them.
Yeah.
And some kids are more apt to it than others. I think she's a little more apt. That's why we're here today. Okay, in about 30 minutes or 40 minutes, if you give them that pink card up front, they'll take you back there to the recovery room. Then about 30 minutes to an hour later, you'll go up to 3D, and that's where she'll be overnight. My team, Dr. Littlejohn, and my nurse practitioner will be checking on her. They'll check on her first thing in the morning, give me a report, and then if everything's going, we'll take out the catheter and then start getting it ready. I plan on coming around, you know, late morning or lunchtime. I'm not exactly sure yet when I'm going to come by, but it'll be in that range.
Okay.
Okay?
Okay.
Sure, my pleasure. All right.
Appreciate it.
All right,
so
sure
much.
thing. All right, we'll celebrate in a month.
Yes, definitely.
One step down.
Thanks again.
Sure thing. See you later.
Bye bye.